12:09 on the clock. A very, very good afternoon to you. It's noon time already and it is 32 degrees Celsius Bahar. Humidity here 44%. Winds blowing at 10 kilometers per hour. Very, very good afternoon to you. Whilst we are talking about things that matter and we laugh a bit, we cry a bit, we share stories, we come together as one community and one family, it is also very important that we don't forget the men. And the reason why I say this is the month of November and it is Movember, and that's why we talk about men, their health, even more during this time of the month. It is a time that I introduce you to Dr. Ahmed, the Hindawy, a specialist urologist, a Saudi German hospital. He's here to talk to us a little bit about Movember. A very good afternoon to you, Doctor.
Good afternoon. Good afternoon to everyone.
Well, Doctor, first things first, we do celebrate women around the month of October. We keep talking about them. We talk about breast cancer. But Movember, we have recently known about it. Men do know about it, but they don't really know what to do with it. And what is the most common health issues that affect men in today's day and age?
Okay, first, welcome for you and for everyone. For sure, there is a lot of health issues related to the men. And especially in the elder age, we can say like heart diseases, cancer, diabetes, respiratory diseases, prostate cancer mainly as a urology doctor, and testicular cancer also. These all issues should be put in consideration in talking about the men's health.
Right. Now, Doctor, if you can also talk to us a little bit about Movember, how can men reduce the risk of prostate cancer? And if you could just emphasize, why do we celebrate this as the month where men need to be focusing on their health?
Okay, as you said before, that October is the month of the women, and breast cancer also is one of the most important issues related to the women. Also, men. Prostate cancer is one of the most common cancer in men. And as long as we can detect this disease early, the patient will be safe and the management of the disease will be easy. For that, regular examination, especially at the age of 50 years old, is very important for every man yearly. And this examination is including some tests, which is important to give us an idea about how is the condition of the prostate and our expectation about the future of this prostate, if it's going to be in risk for cancer, or everything is okay and he just need to check up.
Absolutely, Doctor. Now, but talk to me a little bit about how can we reduce the risk of prostate cancer? Are there any early signs, any symptoms that men should take a note of?
Okay. Signs is including any change in the urine. The man can detect some changes in the urine, like changing in the color, in the habit, how many times he's going to washroom, if there any burning sensation, if there is, especially at night, he woke up at night to go to washroom, urgency, he cannot hold the urine. This is all signs indicating that there is something in the urinary tract, maybe in the prostate, and is more risky in the men over 50 years old. And these all signs give us indicator about what kind of the disease is there. And if they need to do something to avoid this risk or to avoid the progression of like these diseases, it's including all in the lifestyle, like the kind of nutrition and diet, avoiding heavy meals like meat, especially animals food. Try to move more to the vegetables and fruits. Maintain their body weight index less than 25. Control intake of alcohol. Avoid smoking. Avoid exposure to chemicals. Regular exercise. All these rules in the lifestyle maybe help and decrease the risk of cancer prostate.
Absolutely. In fact, my next question, Dr. Ahmed, to you was, what role does lifestyle like diet, exercise, and stress that we all endure play in preventing men's health issues?
Well, regular exercise is very important because as long as there is much increase in the body weight, there is increase in the risk of the cancer prostate and also in the symptoms related to the urology symptoms. fat in the food, high fat intake, and also high protein animals protein especially. All these increase the risk. Some people, according to their jobs, exposure to chemicals, but also as long as they can avoid exposure to these chemicals is very important. Alcohol and smoking is one of the most risk factor for development of cancer prostate. Also, sexual transmitted disease. As long as he can avoid sexual transmitted diseases, also our early detection and the treatment of this, he will be safe from cancer prostate.
Right. Now, is there any particular way that you'd say how can men maintain healthy relationships and communication with their healthcare providers? It's not every day, doctor, that you would have a man opening up about his health problems with the doctor. Women still, to an extent, open up, but men don't. How would you encourage them to go up to their healthcare professionals and talk to them?
For sure, by your orientation for them that, like women, men need to go to do checkup every year, especially at the age of 50 years old. If there is no family history of the previous cancer diseases, there is an exception. If the man has a family history of cancer prostate, this examination should be started on 45 years old. And this examination should be done yearly with the communication with the healthcare provider. He can do some tests like blood test for him, PSA, which is one of the important indicators for the cancer prostate and the early detection of it also. And the ultrasound and some examination can give us all information related to the prostate of the men. Also, if any man at any age noticed that there is something, it changes in the urine, he should directly go to the urology doctor and check it, because maybe this is something simple related to the food, and maybe this is something serious related to a big problem inside the urology system. And at that time, as long as we can detect it early, there will be no problem.
Absolutely. Thank you so very much, Doctor, for taking time out and having this chat with us. And I think it means the world to us that you're here to educate all of us to do the right thing. So first things first, I think we all need to go and meet our healthcare providers and professionals, right?
Right.
And how important would you say are the regular checkups and screening for men's health?
As I told you, that is yearly. Every year, men should come to check the prostate and to do the blood test and ultrasound for them. And if there is any disease or any problem in the urinary system, he should take a medication for it and try to solve it early to avoid any other complication in the future.
Thank you so very much, and looking forward to having a conversation with you very soon, Doctor.
Most welcome. Thank you. Thank you.
Well, coming up next is also a track that I absolutely love. Abhi, I just got a feedback on something and I don't know whether he's listening in. Now, if you are listening in, then this one's for you. He said, I love Kishorda. I love Kishorda. Can you play me something like that? And I said, okay, let me try and see if I can, wave a wand and bring back the old days. Now this one's for you because I absolutely love this song. It's called Samne Ye Kaun Aaya. And after that, you will hear another track that says Tera Naam Liya. Listen to this and I'll be right back on Talk 100.3. My name is Muriel, keeping you company.